The Sustainable Mechanism for Improving Livelihood and Household Empowerment, SMILE, is a 5-year project funded by the President's Emergency Plan for AIDS Response through the United States Agency for International Development, USAID. The project, which spans from April 2013 to March 2018, is implemented by Catholic Relief Services with support from ActionAid and WestStat. SMILE is designed to scale up care and support services for orphans and vulnerable children in 5 states of Nigeria, which include Benue, Kogi, Edo and Nasarawa states, and the Federal Capital Territory. SMILE seeks to improve the well-being of 600,000 vulnerable children and 150,000 caregivers, while also working with government to strengthen the national and subnational response to household vulnerability. It is implemented through an umbrella grants mechanism whereby partner civil society organizations receive sub-grants to support capacity strengthening and program implementation at the community level.
The Nigerian Demographic and Health Survey, carried out in 2013, revealed that about 6% of children in Nigeria have lost one or both parents. The loss of a parent makes a growing child vulnerable to malnutrition, diseases, educational and social exclusion.
SMILE supports the provision of a range of services that are tailored to the identified needs of the children and their households. The services provided to our beneficiaries range from household economic strengthening to HIV prevention care and support, nutrition, psychosocial support, educational support, amongst others.
So SMILE operates from a theory of change which believes that if the government systems that responds to the crisis of orphans and vulnerable children in Nigeria are strengthened, and if civil society organizations are supported to provide basic services to identified vulnerable households, then these households will become more resilient as they travel on the pathway to prosperity.
SMILE supports the prevention and management of opportunistic infection that can occur in HIV infection through our home visits conducted by our community volunteers.
HIV and AIDS is a leading cause of vulnerability amongst children in Nigeria. In 2015, it was reported that about 1.8 million children were orphaned due to AIDS, and many more live in households where at least one family member is infected by HIV and AIDS. Until recently, the Nigerian response to the crisis of child vulnerability brought about by HIV and other causes of vulnerability has been largely driven by communities. Extended family systems have provided support to these affected children. However, the needs of OVC far overwhelms the capacity of communities to provide services and care for them.
The project, through its community volunteers, identify HIV-positive pregnant women and link them to health facilities to be able to access prevention of mother-to-child transmission of HIV services, which ensure that their unborn children are born without HIV. After delivery, the mothers and their children who have been exposed to HIV are linked with early infant diagnosis services to ascertain the HIV status of the children, and they're followed up as necessary as well.
SMILE builds the capacity of families and community members to provide community-based HIV services. It facilitates the linkage of HIV-positive children with access to treatment at the health facilities. This has been identified as a huge gap in the HIV response in Nigeria.
This is very important in line with the UNAIDS 90-90-90 strategy to ensure that all people living with HIV attain viral suppression, and pediatric adherence support is provided during the home visits by the community volunteers.
I enroll household into the program. I also mobilize PLS, which is people living with HIV and AIDS, orphans, and the household members. After doing the HIV counseling and tests, if there is anyone, we refer to hospital.
We also carry out nutrition education, and we do TB symptom screening. Then we also do follow-up to make sure that they adhere to their drugs and every instruction that is given to them.
We also screen the children for their nutritional status to be able to detect any case of malnutrition which affects the adherence of the children to their medication. We conduct quarterly screening of HIV-positive beneficiaries for symptoms of opportunistic infections such as tuberculosis. Another unique aspect of the SMILE project is the integration of childhood TB services into the existing project. Nigeria has the highest burden of TB in Africa, and on the global level, it ranks 4th amongst high-burden TB countries.
My son Abel had a problem of coughing. With their intervention, we were able to take this boy to one rural health center. A test was conducted on him, and TB was discovered to be the case. And since he started the treatment, the extent of the cough had reduced drastically.
One of the underlying strategies that we use that cuts across all our activities, of course, is the strengthening of the community to facility linkages for TB services. And for those children who are diagnosed with TB and commenced on TB treatment, the case managers provide adherence support to them at the home level.
SMILE seeks to improve the livelihood of project beneficiaries in a sustainable manner. To achieve this, SMILE, working through civil society organizations, is building household resilience by engaging caregivers in market-driven activities to enable them earn income, improve their well-being, and that of the children under their care. The project's approach is one that looks at the different vulnerability categories of individuals and implements a mix of interventions suited for the different vulnerability categories.
My name is Faith Monday. When this SMILE program never come to me, nothing. But when the SMILE program come, they do many things for me. They give us food, they give us clothes, they give us money until they do fish business. And because they use the money, they buy fish, they sell. They sponsor my children for school, pay their school fees, buy their books.
Economic strategies include developing agricultural value chains, vocational skills training, and supporting caregivers and communities to participate in SILK activities. SILK is a model in CRS called Savings and Internal Lending Communities, which is made up of a group of people who come together to save, and from the pool of these savings, they take out loans. From those loans, individuals can either start a new business or expand existing businesses. SILK also helps with social cohesion because members who come together every week will know each other better, and that helps even in increasing the solidarity in the community. We're also investing in increasing the involvement of the community in supporting the food security initiative of the project through food banks.
The SILK methodology is one wonderful intervention that has actually resulted in the improvement of lives. A lot of people feel that the poor cannot save, but we have proven in SILK that anybody can save. It depends on how much you are saving and how long you save. Apart from the financial products of SILK, is also that component that builds solidarity in the community and brings the community together so that they are able to support each other and move on as a society.
The SMILE project has improved both the food security and nutrition security of caregivers. In terms of food security, people have ready access to food, but for nutrition security, we have achieved that through the intervention around agricultural inputs, such as the Pro-Vitamin A cassava and orange flesh sweet potato, because as these inputs are being consumed, they satisfy the need for food and hunger, and also satisfy the hidden hunger, which in this case is a vitamin A deficiency. The Cash Transfer Scheme is one of SMILE Project's social protection services targeted at improving the livelihoods of vulnerable households in the 5 project states. The objective of the cash transfer is to improve household income, stabilize household consumption, recovery from shocks, economic resilience, and reduce their vulnerability. The scheme involves provision of cash for consumption support of the most vulnerable households and cash to support rapid business development, including startups and expansion of existing viable businesses.
This one now what's going to make your pikin shine, which is the ugu leaf. Even tomatoes too.
Furthermore, as part of her nutrition approaches, SMILE strengthens the capacity of civil society organizations to increase nutrition awareness and conduct nutrition assessments, counseling, and support.
The Nigerian National Nutrition and Health Survey showed that 32.9% of children under 5 years of age are stunted, while 7.2% are acutely malnourished, indicating nutritional deficiency among children. For this reason, we support them to have good nutrition to survive, as damage in early life can lead to permanent impairment. My project has improved the lives of our beneficiaries since inception. They have been able to have information, knowledge on nutrition interventions for themselves, for their households, and the OVC that we are serving.
Access to education is also one of the major needs of our beneficiaries. So what the SMILE project does is work with communities, schools, local government education authorities, and state universal basic education boards to improve access to both formal and informal education. We have an early childhood education pilot in 15 selected local government areas where SMILE works. These are community-based centers that are facilitated by volunteer teachers who provide recreation and early learning facilities for children aged 3 to 5 years. This aims to stimulate physical, psychological, cognitive, and social development. For those beneficiaries who are found not to have access to education due to financial constraints, we also operate a block grant mechanism, whereby we engage schools and provide them with educational resources in exchange for waivers for school levies for the children that have been identified.
And children were moving around, roaming about, not coming to the school. And that made me to say, okay, let me support the SMILE program by enrolling almost 10 of the children into the school. The performance of the children once, they come to school almost every day because they are happy for what the SMILE have done and the head teacher have done to them. And the academic performance is very excellent.
We have another group of children who, for one reason or the other, cannot attend the formal schooling sector. So for those who are interested, we facilitate access to vocational skills acquisition. The girl-child education is a core component of the SMILE project because this has been found to be a major gap. To improve access to education for the girl child, SMILE project conducts advocacy and sensitization programs to leaders of influence in the community and household heads. We also work to address gender norms that have been identified as hindrances to access to education for the girl child.
One of the key elements of the SMILE project is the provision of psychosocial support to both the children and the caregivers. It's been found that enhanced psychosocial status of the children has a profound effect on the general well-being of the children. So through the coordination of kids club activities, during which age-appropriate recreational activities are conducted, we've found that the psychosocial status of many of our children has improved. There are certain cultural norms that existed before that determined how parents interacted with their children. But with the coming of the SMILE project, quite a number of things have changed. The perspectives of the caregivers on raising their children, on disciplining their children has changed as well.
Before, I was not able to speak in the crowd, but now when I'm in the crowd, I'm improving how to speak well. It helps me a lot that I am obedient and I always listen to my teachers in the class, and now my result is better than before.
Strengthening systems, policies and structures enhance state and local government capacity to independently coordinate and manage OVC programs in their respective locations. SMILE provides institutional and technical capacity support to the states and local government areas.
Organizational development has a strategy, has a process which we call the strategic capacity development processes. We use a tool that is called Organization Development Tool, which has across board 8 domains, and a lot of successes have also been noted within the strategy.
Through her investment in strengthening social welfare systems and referral networks, SMILE is promoting true continuum of care across community and clinical services for children and families affected by HIV. SMILE's system strengthening efforts seek a sustainable and coordinated country-owned response with priority on efforts that increase human and financial resources and phase out reliance on support from donor agencies.
This support is embedded within the institutional support framework for the states and local government areas.
The SMILE project has brought so many innovations to the state, local government, and even the communities, because there are so many things we don't even have awareness of. So they have made us to realize that it's better to learn how to fish than waiting to be given fish.
SMILE views capacity strengthening as a process that improves the ability of an individual, group, organization, network, or system to enhance or develop new knowledge, skills, attitudes, systems, and structures to enable effective functioning and to work towards sustainability and achievement of goals.
Since the inception of the SMILE project in Lokoja local government, we have been able to put in place a local government quality improvement team and the community improvement team that the local government is working along with the community for the well-being of the OVC, and it has been a success.
Consequently, SMILE continues to develop the capacities of State Ministry of Women Affairs and Social Development and supports the establishment of functional coordination mechanisms in the states.
So with the help of SMILE, we're able to put in place basic group like the technical working group, that's a grassroots group for monitoring OVC in the state. SMILE is not just with the Ministry of Women Affairs in there, but with children outside and families. And I think the household strengthening has been wonderful.
This approach is particularly relevant across the project states where such coordination groups did not previously exist.
When SMILE came in, they ensured that we have some desk officers that we work with the community, especially the M&E. The M&E and also the admin staffs. We also have social welfare staffs, especially at the area offices. So most of them were engaged. But when, before SMILE, we don't have functional M&E.
So I would say, by and large, working with SMILE, partnering with SMILE, it actually improves our capacity.
We're very thankful, and for me it's a great honor that I have been put in a position where in the future I can always be proud that I had this opportunity to work with SMILE.
We're extremely proud of SMILE's achievements and the way it has truly transformed lives.
SMILE continues to emphasize family-centered socio-economic care as the most appropriate approach to working with children and families, recognizing that socio-economic interventions that strengthen familial stability and promote children's resilience also have the double benefit of reducing HIV risk and supporting client retention in care and treatment. SMILE programs are designed to support graduation out of the program when enrolled beneficiaries are assessed to be safe, schooled, stable, and healthy.